Okay. Good afternoon. My name is Tony, and today I will be performing the neurological and musculoskeletal examination on my patient, John Doe. This exam will be done completely over clothing, and we've done some examinations in the past, and I will be moving on to this one. So I will start off with cranial nerve number 1, where we'll have you hold your right nostril and breathe in on your left side, in and out, and then repeat the same thing on the other side. Great, that's cranial nerve number 1. And the airway is patent and clear and symmetric. Cranial nerve number 2, I'm going to stand in front of you. I am going to have you cover your right eye. I'll cover my left eye, and I want you to tell me how many fingers I'm holding up.
2. 2.
Good. And I cover this one.
1.
You have to look here.
1.
Good. Okay. And then I actually normally have him use a Snellen chart, which we don't have today, where he would stand 20 feet away and read on the lowest line. So the visual fields are full and symmetric. We're going to move on. Excuse me. We've actually done this video 3 times, having some technology issues. So cranial nerve number 3, 4, and 6 we're going to check next, and that's going to be the extraocular movements. And this is where I will be using a light and having look at the 6 cardinal gazes. So if I can just have you follow the light. Good. Just your eyes. Perfect. Okay, so there was no nice nystagmus, which is what we'd be checking for here. It was smooth tracking and full range of motion in all directions. Next we have cranial nerve number 5, which is the trigeminal sensation and motor. And so this is where I will palpate the masseter and temporalis muscles with his jaw clenched. So if you can go ahead and clench your jaw. Okay, good. And then at the same time, open. Good. All right. I'm also going to have you close your eyes, and I want you to let me know if you feel me touch anywhere on your face.
Yes. 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 Yes.
Perfect. So this shows that sensation is intact in all 3 branches of the trigeminal nerve distribution. We're going to move on to cranial nerve number 7, which is going to show the facial movements. So I'm going to have you raise your eyebrows. Good. And then close your eyes very tightly. And then next I will have you smile, frown. You could open your eyes. You could pucker your lips. And we can say facial movements are symmetrical and full. And we're going to move on to cranial nerve number 8, which is the whisper test. Okay, so I'm going to whisper 2 words, and you just repeat out loud what you hear me say.
Turkey and ham.
Perfect.
Cranberry bread.
Very good. So he repeats this accurately, and his hearing is intact bilaterally. So next I want to assess cranial nerves number 9 and 10, where I'm going to have him open up and say ah, and I'm going to look at the uvula. Okay, so go ahead and open up. Ah. Okay, it is midline and it does elevate symmetrically, so that those cranial nerves are intact. Next I'm going to press on your shoulders and have you lift up. Good. And the next thing I'm going to have you do is, let's see, turn your head side to side, right? And then, good. So that cranial nerve is intact, 11, and that is a 5 out of a possible 5. Next is the last of the cranial nerves, and I will be looking at the tongue inspection. So I just want you to open up and have your tongue out without saying ah, and then move it side to side. And what I'm doing is just to make sure that the tongue is midline. And so the strength and the coordination is appears to be normal. Next, we have the inspection and palpation of the hands. And we're looking for any redness, swelling, deformities, nodules, and looking for asymmetry. Okay, good. And then I want to check the 3 joints. We have first the MCP, the PIP, and the DIP. So we're just checking each of them to make sure that there's no tenderness and no crepitus. Good. All right. So that's the hands. There's none of that present. Gonna check for capillary refill. I do have to talk a little fast because apparently my storage is full on the phone. All right, and it's less than 2 seconds, which is a normal finding bilaterally. Next, we have the radial pulses. I'll also be palpating them at the same time. And good. So both our radial pulses are present. The rate and the amplitude are normal and equal. Next, we're going to do the upper extremity and skin assessment. And this would be so much easier to do without the clothing. But we are going to be looking overall at the warmth, the color, edema, the skin integrity to this whole upper area. And feeling for, again, for any nodules, any abnormal findings, looking at skin symmetry. And everything is within normal limits. Next, we're moving on to the finger range of motion, where I'm going to have you open and close your hands. Good. And then I'm going to have you hyperextend, or actually like this, and then open your fingers, which is abduction, and then bring the fingers together, abduction, and then the fingers to the thumbs. Good. So the range of motion is full. This is normal. If you could squeeze my hand, okay, good. That is equal and strong and symmetric, which gives you 5 out of a possible 5. Next, we're going to move on to the wrist, and we'll be looking for all those same findings, but it's just very specific to this area for redness, swelling, deformities, nodules, and crepitus in the wrist area. Having that, okay, both sides. Very good. And then there's none of that present. And what we'll do is next assess for the range of motion in this area. So I'm going to have you up and down with the wrist. Good. And then rotate the wrist. Good. So there is no ulnar or radial deviations, and range of motion is full and is painless. So next we're going to go on to the elbows, which I find to be the easiest. And we're going to, first I'm going to observe and palpate those areas for the very same things, the, any deformities, swelling, nodules, and tenderness, but none are noted. So then the next thing I'll have you do is just bring your elbows, your hands up, and then extend. Good. And then if you could hyper extend, that good. So they are smooth and full. The next we're going to check for is the biceps and the triceps. So I'll have you hold your hands up, if you would, and then push me up. Good. And if you could put your hands down and push me down. Good. So the biceps and the triceps, the strength is assessed, and it's a 5 out of 5. Next is going to be the shoulder inspection, and palpation and range of motion. And we're looking for the symmetry. This is one where I do need to kind of step to the back as well, looking at to make sure that the clavicles are even, the scapula are even, and looking for any deformities, which there are none noted, and also looking for the shoulder joint structures, and including the acromyoclavicular area. And at this point, I'm checking, is there any tenderness? No. Okay. Range of motion we're going to check for next. So we're going to raise the arms up, and then we're going to bring them backwards, as far as you can bring them. And then if you can raise them, outward all the way up, and then bring them down. And then last is make big circles, the circumduction. So the range of motion is full and normal in all directions. Next, we'll look at the shoulder girdle strength, and this is where I have him push his shoulders back up. I know we did this on something else. This is good as well. It's full, it's symmetric, and a 5 out of 5. So next I'm going to have you close your eyes, and I'm going to touch in various areas of the upper extremities, and what I'll be checking for is the light touch sensation. So you just let me know and say yes when you feel me touch you.
Yes. 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 Yes.
Perfect. So sensation is intact bilaterally. So next, we have a tuning fork around here somewhere. I think.
Put it away.
Okay. All right. So the next thing I'm going to do is I'm gonna place the tuning fork over the proximal ulnar prominence, and I just want you to let me know when you feel the vibration stop. Wait, I touched the wrong spot. You put your palm up. Yeah. I'm going after this side right here.
Yes.
Okay, let me check one more area, if you don't mind.
Yes.
Okay. Next I want to check for the cerebellar coordination, and this is where we're going to have you, we did it before, but it falls under this section too, so we're just going to do it again with the opposition. And then I want you to take your right hand and just kind of flip-flop it, and then other hand. Very good. Now I'm going to stand in front of you. I'm going to hold my finger out. I want you to touch your nose and then my finger. So if you could use your right hand, please. Perfect. Now switch fingers. Good. All right. So the cerebral coordination is smooth and it's intact. Next, we're gonna I'm gonna actually place an object in your hand. I'm gonna have you close your eyes, hold your hand out, and if you could just tell me what this object is.
It's a pen.
Okay, very good. So this is checking for stereognosis, which is normal. Next, we're gonna do graphesthesia, where I also have you still close your eyes. I'm gonna trace something in your hand, and I want you to tell me what I'm tracing.
An 8.
Yes, good. So that is intact. Next, we're going to do the deep tendon reflexes. So first is going to be the brachioradialis. So I will be tapping over the distal radius. Okay. Over here. Very good. So that one is 2+, which is normal. The next thing I'm going to do is the bicep tendon, which I'm going to have him first. If you would just, yep. I'll put my hand over here. I think I better go on, I don't know how to do it. I guess I'm going to do it on the side. All right, go ahead and make a muscle. I'll bring your arm up. Okay, good. Now, I'm going to strike my own hand to see if I can elicit a response. Good. So that also shows 2+. And then the next is the tricep. So I'm going to bring your arm out and just have you dangle it. All right, dangle it right over. Okay, very good. All right, and I would be doing that on both sides. And that does show 2+ as well. And that would, the extremity reflexes are symmetrical. Next is going to be the lower extremities. So what we're gonna do is look at the toes, and I'm gonna be doing an inspection and palpation of that area, looking for any redness, swelling, deformities, lesions, and nodules. So I'm gonna pull your socks off. Okay. We're just gonna keep them off for a minute because we have a couple things to do. Okay. Alright, so we're palpating all that area. Alright, while I'm here, I'm going to check for capillary refill too. In both of the big toes, and that is present. And there was no tenderness, no crepitus to the feet. The next thing I want to do is just check for the range of motion. So what I'll have you do is flex your toes. Good. And then point down, and then hyperextend up. Good. So can you spread your toes apart and then bring them back together? So the range of motion is full in this area. We'll put your socks back on in a minute. I did already check for the nail beds, the capillary refill, so we're good with that. The next thing I wanted to check for was lower extremity overall skin assessment. Again, hard to do over pants, but we are looking for the warmth, the color, looking for any edema, skin integrity, make sure there's nothing open, and the skin is intact. The next part is the ankles. So we'll inspect the ankles, and we're going to be looking again for swelling, deformity, nodules, and tenderness. And I will be also checking for the pulse. The pulse is down over here. The pedal pulse, both sides. Okay, behind the popliteal, which is behind the knees. Good. And then I'm gonna have you dorsiflex your ankles. Good. That's what. And then inversion, eversion, rotation of the ankles. So that. To the specialist you're going. There's a little crack there. So the range of motion is actually full. So I want to have you push up with your ankle. Go ahead and push up. You're good. All right. Against resistance. I'll also have you push downward to do like on a gas pedal. If you could push down for me. Good. All right. So all that is equal. The strength is 5 out of a possible 5 there. Next, we're going to move on to the knees, and we're looking again for any swelling, deformities, tenderness, so I'm going to palpate those areas. All right. And then at the same time, I'm going to have you extend. I'm going to have you extend the knees, but I'm going to kind of hold down. I want you to do it against resistance. So if you could straighten both your legs, I don't want you to get kicked. Go ahead. Oh, wow. Okay. Good. So the strength is a 5 out of 5. You said that flex the knees. That's really all you could do with the knees is glide them forward and backwards. Just making sure I didn't miss anything. With the hips, I want to have you assess. Actually, I'm going to have you stand up, because what I'm going to look for is the limb length. So I want to check front and back over here, and then I'll have you turn to the side. So I'm looking to make sure that the hip is normal, and I'm going to have you bring your right leg up and then backwards. Good. And then do the same thing with your other leg. Good. And have you rotate your knee out.
Like this?
So in other words, like this. Bring your knee, point it, yep. And then inward, like towards your other knee, and then do the same thing with the other one, using your hip. I want to see, yep, good. Excellent. So the, and then if you could just kind of go like this too, bring your right leg out and then in, and then, yeah, oh, your balance is good. And then the same, all right, good. That's abduction and adduction. So you can actually sit back down up on the exam table. So So that is a 5 out of 5. Everything was able to go in all directions. So I want to do the light touch sensation just as we did before with the upper extremities. We're going to do that with the lower. So I'll have you close your eyes and then tell me whenever you feel me touch you.
Yes. 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 Yes.
Good. All right. So the sensation is intact. The next thing we want to check for is the vibration to the medial malleus. So we're going to do that again. Move your ankle. Let me know if you feel that.
Yes.
Okay, good. And did it? Let me know when you don't feel it anymore. Sorry.
Yes.
Okay. Now we'll do that again. On the other side.
Yes.
Okay, good. All right. So John did identify the vibration appropriately. So now we're gonna look at the spine. I hate to have you do this again, but I do need you to stand up. And what we're gonna do is do a couple things with the spine. So I guess I'll come on this side this time, have you go this way. All right, and I'm looking to make sure that there's no curvature and that the spine is indeed straight. Again, looking at that shoulder, making sure that the height is symmetrical. I am gonna palpate down every vertebrae. Is there any tenderness?
None.
Okay. I want you to bend forwards. Okay, and then come up and go backwards. Okay, good. That's hyperextension. And now I'm gonna have you lean to the, probably face the camera again, and then lean to the left, and then lean to the right. Good, and then rotate your torso. Okay, good. So I can definitely have you sit back down. All right, get yourself comfortable over there. The spine is actually, there was no tenderness, and the range of motion was full range of motion with no limitations. There was no scoliosis present, so we did screen for scoliosis. And so now the Romberg test, you're gonna kill me. I know, right? Okay, so with your feet together and your arms at your side, I'm gonna first have you stand there with your eyes open, and we're gonna see what happens just with your feet together. Then we'll have you close your eyes, and I just wanna assess your balance, which is good. Negative Romberg test. I'm not sure yet right now. For pronator drift, we're gonna have you stretch out your arms with your palms up, all right? And I'm gonna have you close your eyes,
Mm-hmm.
all right?
Closed.
Good. And what we're making sure is that one arm or the other doesn't drift down, and it did not. So that is a normal finding. The next thing I need you to do is just walk across the room. I'm looking at your gait to make sure that it's steady and coordinated. Okay, good. And then the next one is your heels, doing the heel to toe test. So this is where you're gonna walk on your heels. Walk on your heels, hold it, yep, good. And and then now on your toes. Okay, good. And now heel to toe in a straight line. This is like a field sobriety test. All movements are stable and coordinated. Okay. Let's see. So I think what we'll do next is, why don't we move on to some of the functional tests, and we can do like a deep knee bend, okay? So you can do it like that, and then bring it up behind you. So if you stand on this side, yep, and then bring your knee up behind you, like your foot up behind you, good. And then the other one, good. All right, can you also hop in one place on both feet? All right, yeah, go good. And then how about hop on the right foot only, and then the left foot. Which I have a chandelier, good. So you did that safely with good coordination. This completes the complete neurological and musculoskeletal examination. My patient John Doe, thank you so much. All findings on inspection, palpation, and strength testing, sensory assessment, reflex, evaluation, cerebellar coordination, and gait testing were all normal. Thank you so much.
Till next time.